Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit NPTEFF.com to enroll today so you can pass tomorrow. Thank you for joining us here on the NPTE Final Frontier podcast. My name is Dr. David Friedberg.
And my name is Dr. Emily Gerby. Today, we're going to be discussing the hemodynamic response to exercise. Specifically, how to interpret cardiac output and blood pressure, and when specific exercise termination criteria requires you to immediately stop a session for patient safety.
All right, let's do a question. During aerobic exercise, a patient's systolic blood pressure drops more than 20 millimeters per mercury. From baseline, while workload is increasing, what should the physical therapist do next? Is it option A, continue exercise and recheck vitals in 5 minutes? Option B, stop exercise and monitor for other systems? Option C, increase intensity to maintain cardiac output? Or is it option D, have the patient perform a Valsalva maneuver to stabilize blood pressure?
All right, so let's dive into these option choices. But first, let's remember the key parts of this question stem. So we know our patient is doing aerobic exercise, and we notice that their systolic blood pressure drops more than 20 millimeters of mercury from baseline, while their workload is increasing. So we need to think patient safety. We need to think about these exercise termination criterias and determine what would be best to do for this patient. So first up, we had option A, continue exercise and recheck in 5 minutes. Now, a systolic blood pressure greater than 20 millimeters of mercury is when we would want to have a hard stop according to termination criteria. If the systolic blood pressure drop was greater than 10 millimeters of mercury, this is when we could have more cautionary measures, maybe just continue with caution and recheck. But again, since their blood pressure dropped greater than 20 millimeters per mercury, that is a hard stop according to termination criteria, meaning that option A would be unsafe. Now we have option B, stop exercise and monitor for other symptoms. Now this is the correct answer, going off of what I just had said when we were reviewing the previous option choice. Remember that systolic blood pressure drop greater than 20 millimeters of mercury is a definitive termination criteria. This reflects failure to maintain cardiac output and places the patient at immediate cardiovascular risk. So again, option B is the correct answer choice. We would want to stop the session immediately. Option C had said increase intensity. Now this would further increase myocardial oxygen demand while the patient is already showing signs of cardiac output failure. This is dangerous and inappropriate. So we want to definitely cross off option C. And then option D, perform a Valsalva maneuver. This would reduce venous return and stroke volume, causing cardiac output and blood pressure to drop even further. This would significantly worsen instability. So again, we also want to cross off option D, meaning that option B, stop exercise for a systolic blood pressure greater than 20 millimeters of mercury, is the correct answer choice. Now I'm going to hand it back over to David to discuss some of that termination criteria in more detail.
All right, so here's a full review of the abnormal responses that require stopping exercise. So let's hear about your responses. Exercise hypertension. So if you have the systolic blood pressure greater than 240, or the diastolic blood pressure greater than 110, or there's until medically controlled. So once again, exercise hypertension, so systolic blood pressure greater than 240, and also diastolic blood pressure greater than 110 or until medically controlled. Systolic hypotension, So we have greater than 10 millimeters drop is caution. And then also greater than 20 millimeters drop is an immediate stop. So once again, 10 is going to be caution. 20 is going to be an immediate stop. Unusual heart rate responses, so the failure of a heart rate to increase with exercise. Paradoxical heart rate drop with increasing intensity. Overly rapid heart rate rise out of proportion to the workload. Also, some of the symptoms, such as significant angina, severe leg claudication, undue dyspnea, excessive fatigue, dizziness, and also we have clinical signs such as pallor, cold sweats, ataxia, a new heart murmur, pulmonary rales, onset of significant third heart sounds. And now let's talk a little bit about the ECG abnormalities. So you could also see second or third degree heart block, a new right or left bundle branch block, and also acute ST segment changes. Any of these findings means that the session should be immediately stopped. So make sure that you re-listen to that area and make sure you know properly what you should be doing on that examination.
Yes, being familiar and aware of all of these exercise termination criteria are key to not only help with patient safety, but also help you succeed on your boards exam. So definitely stay tuned for more episodes regarding some of these exercise termination criteria, where we'll dive into some of these other components as well. And for now, on the NPTE, always connect vitals to cardiac output. Heart rate times stroke volume is cardiac output. Don't forget that. If systolic blood pressure drops, it means our cardiac output is failing. If your heart rate doesn't rise, the heart isn't responding appropriately. And if the symptoms or ECG changes appear, numbers no longer matter. The session stops here. Remember, blood pressure thresholds, heart rate behavior, symptoms and signs, as well as ECG findings, all carry equal weight in termination decisions. Safety always comes first, both in the clinic and on the NPTE.
Now that you heard our episode of the podcast, here is a quote from Walt Whitman. Keep your face always towards the sunshine, and shadows will fall behind you. So keep on moving forward. Do not look behind you at that past. All of that negativity, it's not worth it. Keep your face forward and keep on working towards that sunshine. You are powerful. You are strong. You are a final frontier warrior. You will pass.
Thank you very much for listening. For more information on Final Frontier, please visit npteff.com. You can also check out all of our social media platforms such as Facebook, Instagram, TikTok, and X.
Till next time, have a great day and a powerful tomorrow.